Is atrial fibrillation hereditary? I get asked that a lot. People always say to me, you know, my parents had it and I have it, my siblings have it. Is this hereditary? I think the answer to that question is not super simple. I don't believe that atrial fibrillation is hereditary in the basic sense or the way people think, such as you're not born with atrial fibrillation. Little children don't normally have atrial fibrillation. That would be extremely weird or rare. But it is certainly possible to have atrial fibrillation at an earlier age. So in general, people develop AFib primarily, as I've always said, from just getting older. Age, I believe, is the main factor. Statistically speaking, when you hit age 50, 3% of people have AFib. When you hit age 60, 7% of people have atrial fibrillation. When you hit age 70, 10 to 12% of people have atrial fibrillation. If you make in your 80s, 15 to 20% have atrial fibrillation, and if you make in your 90s, up to 30% have atrial fibrillation. So it is something that does develop as you get older, and as I've said before, once you develop atrial fibrillation and it starts to wake up and cause symptoms, your heart walls keep aging and you keep forming more of these AFib sources, cells, triggers, whatever you want to call them, and so the AFib does wake up more and more over time. However, when people say, well, I had AFib at a much younger age, in my 20s or 30s, is that due to aging? That doesn't seem very old. Yes, I think it can certainly still be partly due to aging because there is a 0.5% incidence of atrial fibrillation in people under the age of 50. On the other hand, I also believe that there are families with genetic predispositions to developing atrial fibrillation, and that has been shown in recent research trials to be true. However, I think you have to be a little bit careful when you say, okay, I may have a family predisposition to developing atrial fibrillation. There are definitely known families with clusters of people from the same family having atrial fibrillation at an earlier age. Got to be a little bit careful though. I can certainly say that even if there is a predisposition, which clearly there is, it is still related to other risk factors. It's related to things in the environment. So I like to think of atrial fibrillation as being caused by a combination of non-modifiable risk factors and modifiable risk factors. Now, the non-modifiable risk factors would be things like getting older. Fortunately, we don't yet have a fountain of youth, so getting older is something that all of us have to experience. And as you get older, we know there is a link between getting older and the age-related changes in the heart and developing these AFib sources, cells, triggers. Yes, there can be a genetic predisposition in certain individuals or certain families that can make it easier for you to develop it at an earlier age. Your gender also affects whether or not you develop atrial fibrillation and when. Men definitely have a higher incidence of atrial fibrillation, of developing atrial fibrillation, than women. Women develop it a little bit less than men, but when they do get it, unfortunately, they have a higher risk of stroke. Atrial fibrillation tends to cause stroke, clots and strokes in women more than men. So those are non-modifiable risk factors. Then anything that stretches the walls of the atrium. And so you could have things such as congenital issues, things where your heart is congenitally larger or structurally different, or you could have had previous heart surgery. If you've had previous heart surgery and you create scar in your heart, those would be something that could also help to create these sources of atrial fibrillation. So there are things that could make you have AFib that are something you can't really do anything about, or what we call not modifiable. Those would be, as we said, aging, gender, scarring, structural changes, and of course, possible genetic predisposition. But then there are the modifiable risk factors that also come into play, especially if you have a predisposition to developing atrial fibrillation. Unlike the typical hereditary causes where, hey, I have that disease process from birth, it just runs in the family. No, this is a genetic predisposition if you were to have it. And this interacts with other things, such as the modifiable risk factors. Modifiable risk factors would be things that potentially you could do something about, things you could modify. So these would be things such as high blood pressure. High blood pressure actually causes stretching, pressure in the heart walls, and any kind of stretching of the walls of the left atrium or the left upper chamber of the heart causes these AFib sources or cells to form. Sleep apnea can be caused even people who aren't overweight and snore. which is the typical person who develops sleep apnea. This is a condition where people stop breathing at night. Their brain causes them to stop breathing and they don't get very good sleep, and it causes high pressures in the chambers of the heart that stretches the heart and causes more atrial fibrillation. Then you have things such as structural heart problems. If you have a valve problem, the valves being the one-way valves that let blood go from one chamber of the heart to the next and close, the valve closes so blood can't go backwards. And if you have a leaky valve or a very stiff valve, the pressures in your heart can get very high, and that can cause atrial fibrillation sorts of cells to form, because anything that stretches the heart can also cause AFib. And then of course, just getting older, that stretches the heart as well. So structural heart problems, high blood pressure, sleep apnea. Then you have anything that causes any kind of inflammation in the heart. And that's a whole host of things. Diabetes, poorly controlled diabetes causes a lot of inflammation in the walls of the heart. That can certainly cause atrial fibrillation to form faster. Yes, chronic inflammatory disease processes can also cause it. So if you had rheumatoid arthritis, or you had autoimmune disorders, or chronic kidney disease, these are issues that can cause inflammation. Then just simple things like smoking or drinking alcohol, both of those cause inflammation in your heart. Then you have things like being overweight, obesity. When you are overweight, your heart has a lot more stress, it has a lot more pressure. It does cause pressure in the heart, stretching in the heart, that can cause it. And then of course, there is a known link between lack of exercise and causing atrial fibrillation. If you take two people with the same amount of AFib, and one person goes to the gym 3 times a week and walks on the treadmill and is more cardiovascularly fit versus the person who's very sedentary and doesn't do anything, the person who's very sedentary, their AFib will progress quicker. So I believe that, yes, there is sometimes genetic predispositions in some individuals to developing atrial fibrillation, but it's taken in the context of all of these other modifiable risk factors, such as being overweight, high blood pressure, diabetes, smoking, alcohol, even thyroid disease. Various other things can also interact, whether they exercise or not, to determine when or if they're going to develop atrial fibrillation. Having a predisposition doesn't mean automatically you will develop atrial fibrillation, but it does mean it's much easier for you to, and it's much easier for you to develop it at an earlier stage than other people. But it's not the same thing as I'm born with it. And truth be told, I can certainly tell you, from personal experience, treating patients for this for the last 20 years, 9 times out of 10, when a patient says to me, you know, I think this is hereditary because I have it, and my parents had it, and now my brother just got it. And I say, okay, well, how old is everybody? Well, the patient himself is 60 or 70 years old, sibling is in their 60s, and the parents are in their 80s and 90s. Truth be told, in that situation, it's probably not hereditary. It's just likely that they all lived long enough and got old enough to develop the atrial fibrillation, because as we said, once you get in your 60s and 70s and 80s and 90s, the likelihood of AFib goes up significantly, and so it could just be that they just got it all from getting older, and it wasn't actually hereditary. Now, if you say the family, everyone has it, and they're all in their 20s and 30s, well, then there is probably a genetic predisposition in that family. But for most people, I would look at it less in terms of, oh, I had it genetically and I'm predestined to this, as more of what are my non-modifiable risk factors, what are my modifiable risk factors, and what can I do for the modifiable risk factors to try to reduce me developing this, but knowing that there are things that can make cause you to have AFib even if you do everything right, and those would be the non-modifiable risk factors like aging, your sex being the primary ones, and just try to develop it as late as possible, and once it does develop, treat it appropriately so that this problem is controlled and your symptoms are controlled and it doesn't adversely affect your life.